Where do you think the low-hanging fruit is? Is it facial recognition, voice?
Voice. I think,
voice?
yeah. For mental health, I think definitely voice is where we need to be going, and using machine learning, deep learning to really be able to extract a lot of that information. And so, I mean, if you think about it from a counseling point of view, I mean, that's the key area. That's what we're doing. But you can imagine the sort of the implications that has. Like if you're able to kind of understand that and understand what how people are engaging with their practitioner, what are the things that they're saying, their tone, inflection, etc. You could sort of replicate that into preventative models in terms of engagement with chatbots and things like that, so that you can kind of engage people and then bring them down that therapeutic process, right? I mean, there was an article which I actually just shared on LinkedIn. This was a global study that was done, I think, by maybe Microsoft and Google in terms of employees. And what they found was that almost about 80% of their employees said that they would be happy to engage with AI over a human for mental health difficulties. And the key driver of that was that it was judgment free. Right. So there's still that kind of sense that people have that there is a judgment even when you're with with your therapist, but they are more willing now to engage with with a chatbot or a robot really than they are with the practitioner, because maybe they feel that they can maybe get better outcomes and feel more validated in that sense and less judged. And understanding that, I think, from a therapeutic point of view for us becomes really important. But if we can, I mean, the implications around that are also really huge from a training perspective, right? Like if you understand what the engagement is, who is engaging, why, what do you need to be saying in therapy to get the outcomes, that could really influence all our training models in mental health. As well. I mean, so there are huge implications of that, and that's why I'm really excited about that in terms of where the development is going to go for CyberClinic.
Yeah, I think we're kind of. I mean, digital mental health has kind of been talked about for a little while, and there are a variety of web based products, and there are thousands of applications out there trying to promise this or that, and but engagement and that sort of step forward has been the notorious challenge, hasn't it? It's been one of those things that a lot of trials in a clinical context with digital health tools in the past have kind of shown a more optimistic view on how effective it was going to be than what actually translated into reality. And I think that that idea of how difficult it is to reveal ourselves and being more comfortable when we are interacting with a non-human, or perhaps via an avatar or via some kind of alter ego. We see what we do on social media. People sometimes are anonymous, and they're certainly very vocal with their opinions about things. But if they have to identify themselves, it's a different story. And I suppose it's just part of human nature. We all have that silent majority within us. So overcoming those barriers and actually starting the journey, feeling comfortable, getting okay with the idea is a big part of the opportunity. I think it almost feels to me as though we're now on the cusp of a revolution, I guess, in the fields of digital mental health care. What are your thoughts?
No, absolutely. I think, and COVID largely has, accelerated that process. I started CyberClinic about, 3 years ago. The first year was really a lot of research and, really looking at the market and what the needs are. And the initial uptake was really, quite low for the reasons I mentioned right at the beginning of this talk. But COVID has really accelerated it, and what I've seen as well in terms of just the way from a therapeutic point of view, engagement online with patients, that the nature of that has also changed. And how I engage and clinically deliver treatment. But what we're seeing is that because of COVID, because of Zoom, because of working from home, a lot of our practitioners now have become very comfortable doing it online. So where there was a lot of, not a lot, but there was some resistance around doing the online. Now people have become, very comfortable with it. And so our future is going to be, from a service delivery point of view, it's going to become a blended approach, just like working from home. So we are going to have to seamlessly move people between online, offline modalities, but still providing the same continuity of care for them. And that's going to be the real challenge in terms of what systems are able to do that. And that's where, CyberClinic is really positioned to start to develop that modality, so that the patient experience is consistent, the practitioner experience is profound in a way that they can actually provide the treatment that they want to their patient, and so both parties come out winning, really.
Oh, absolutely. I was just going to say, in a previous life before Core Plus and Health Tech X, I'd co-founded a teleradiology service. And what was really remarkable about that was that the radiologists who are engaging with it, and we're talking sort of in the early mid-2000s here, the radiologists that were engaging with it, they were able to not just work with it, but they actually restructured their entire lives, including their families around it, so that they stopped just working for one organization and they started working for multiple organizations. And then all of a sudden the opportunity to, I remember these two radiologists in particular, they always had these were separate people. They had these dreams. One wanted to, had a dream to go to Aspen for 2 months, and but could never take the time away because they were just in one contract. Once they actually discovered teleradiology, not only did they go to Aspen for 2 months, but they spent the rest of the year as a family traveling to different parts of the world. And they would check in and read, so to speak, that was the terminology for it, do the reading for a couple of hours a day, Monday to Friday. And they were able to actually, incorporate a lifestyle and better family balance into their professional lives as well. So in a sense, that was a real precursor to the idea of the digital nomad, somebody who has skills, but those skills are entirely transportable. They physically embody those skills, so they can move anywhere on the planet. Yeah. But as long as there's a framework like this, like telehealth, like digital health programs, then you are no longer confined to this location where you used to have to be in order to get work and to participate in the workplace. And I think that's a really understated benefit to the practitioner, that you can actually reimagine your life as well, the way that you remain a professional and earn your professional income and standing. Digital mental health and digital health gives us that opportunity to it's all up for reimagination.
Absolutely, yeah. I mean, it's fairly consistent with your tagline, reimagining healthcare, and that's exactly what this is about, isn't it? It's about reimagining your life, and on that point, it's a really interesting point, because I've actually had a couple of practitioners who have moved interstate, but because they've been on the CyberClinic platform and their patients have been on the platform, they've been able to take them with them. So there's been no disruption to their practice. And so it goes to that sort of the idea of the digital nomad, that you can actually go wherever you want now, and without the fear of actually losing your practice or your patient base. And a lot of patients that you've been seeing for many years who want to continue seeing you as well, right?
Absolutely.